Now I'm starting. My name is Ersun Topal. I'm a general surgeon with 13 years of experience, and I represent Doruk Hospital. Doruk Hospital has been giving healthcare service to both Turkish and international patients since 1971. And today I have a topic about metabolic surgery. What is the obesity? The definition of obesity is when an individual BMI is over 40. According to WHO Regional Office for European countries, based on the latest estimates in European Union countries, obesity affect about 10 to 30% of adults. And the other organization is World Obesity Organization. According to this organization, over 1 billion affected by obesity and 177 million adults severely affected by the obesity by 2025. Now let's talk about the metabolic syndrome. Prevalence of diabetes increased with degree of the obesity. The rate of obesity in the diabetic subjects was 35.6%, and obesity is the key factor for the cardiovascular diseases and complications. Obesity is associated with hypertension, dyslipidemia, and type 2 diabetes, which are the major predictors of cardiovascular diseases in the future. In 2016, the foundation of the metabolic surgery about the diabetes summary summit meeting. This is the world top diabetes foundation, and 48 members attending this in this conference, which they said with American Diabetes Association, International Diabetes Federation, and Diabetes UK, Diabetes Chinese, and Diabetes India, and other countries. Develop a set of evidence-based recommendation for the surgical treatment of the type 2 diabetes. After this conference, the term of metabolic surgery described by Professor Francesco Rubino and Philip Schauer, which is bariatric surgical procedures, primarily to type 2 diabetes and related metabolic conditions. Even with these therapies in type 2 diabetes, first-line therapy is the lifestyle management, as we know, and the second-line therapy is medication. Even with these therapies, the success rate about 53% in type 2 diabetic patients. But if we look at the metabolic surgery type 2 diabetes remission rate, 78% after metabolic surgery, and the other goal, cardiovascular risk reduction, as hypertension remission rate 63%, and hyperlipidemia remission rate is 65%. These are the some evidence-based article of metabolic surgery after diabetes surgery summit. The algorithm for patients type 2 diabetes in our practice obesity is divided by three classes. Metabolic surgery is recommended to patients with type 2 diabetic, patients with class 1 obesity with poor glycemic control, and type 2 diabetic patients class 2, and all patients with class 3 obese patients. These are the some evidence-based articles of metabolic surgery after diabetes surgery summit. According to the data of 2017, is estimated costs of annual obesity-related healthcare in United States. $350.8 billion in estimated cost of annual obesity-related healthcare, and how much more healthcare cost for individuals with obesity. It's about 42%. In these circumstances, American Surgery Society for Metabolic and Bariatric Surgery has declined their own metabolic surgery in the treatment algorithm for the type 2 diabetes. As a result, metabolic surgery should be recommended to treat type 2 diabetes in patients with class 3 obesity, BMI over the 40, and those with class 2 obesity, BMI with 35 between 39, when hyperglycemia is inadequately controlled by the lifestyle and optimal medical therapy. Surgery should also be considered for patients with type 2 diabetes and BMI over the 40 between 45 point. If hyperglycemia is inadequately controlled despite optimal treatment with oral and injectable medications. The other side, if you look at the United Kingdom about this topic, the president of British Obesity and Metabolic Society, Professor Kerrigan, is stated that the NHS currently spends about £1 million every hour treating diabetes and conditions strongly linked with the obesity. Additional, there is a strong evidence emerging that obesity is also a major preventable risk factors for variety of cancers. He then warned British citizens who has type 2 diabetes with obesity to be treated by metabolic surgery. Today, we know that type 2 diabetes is curable diseases with metabolic surgery. These are a couple of types metabolic surgical procedures, such as sleeve gastrectomy, hernia gastric bypass, laparoscopic gastric banding, and biliopancreatic diversion with duodenal switch. However, we are no longer performing gastric banding surgeries in today. The most common technique in metabolic surgery is the sleeve gastrectomy. We call it restrictive procedures. We always doing with laparoscopically, and I always prefer and just with Medtronic United States brand stepless approved with FDA organization. Gastric volume reduced after the sleeve gastrectomy about 100 or 110 milliliters. Operating time about 40 minutes. Postoperative clear diet starts after 24 hours after. Hospital length, it's about 2 nights classically. Can transport to the airport after discharge. Online free bariatric dietitian follow-up about after the 1 year. This is the second technique, is the gastric bypass surgery. This is the more powerful in diabetes and cardiovascular diseases. This is the malabsorptive procedure, always doing with laparoscopically, and I prefer always and just with Medtronic United States brand stepless approved with the FDA organization. In this technique, gastric volume reduced about 50 and 60 milliliter, and link it or anastomosis with the first part of the jejunum. Operating time, it's about 1 hour or 90 minutes. Postoperative clear diet starts within the 24 hours after, and same hospital length, about 2 nights as the sleeve gastrectomy, and patients can transport to airport after discharge. And we have an online free bariatric dietitian follow-up after the first year. The other technique is SADS. Today, a lot of surgeons prefer this technique. We call it one anastomosis duodenal switch. This is the variant of the duodenal switch, restrictive and plus malabsorptive procedure combination. And always doing with laparoscopically, and I prefer always and just with the Medtronic US brand stepless approved with FDA organization. In this technique, gastric volume reduced 150 milliliter. Operating time, it's about 150, or it's about 3 hours. Hospital length 3 nights, and patient can transport to 5 days after discharge. We have a online free bariatric dietitian follow-up after the first year. The most powerful technique in metabolic surgery is the duodenal switch. Restrictive and more malabsorptive procedure combination, always doing with the laparoscopically, and I prefer always and just with the Medtronic United States brand stepless approved with the FDA organization. In this technique, gastric volume reduced 150 milliliter. Operating time is longer than the SADS and the other procedure. It's about 3 or 4 hours operating time. In this procedure or after this procedure, hospital length about 3 or 5 nights, and patients can transport 5 days after discharge. We having online free bariatric dietitian follow-up after the first year. And duodenal switch and the SADS in this figure, as you can see, and this is the technical details. After that, we want to give, or I want to explain about the complications. As you can see, the minimal complications in this metabolic surgery. that ratio about less than 1%, and sepsis or anastomosis, anastomotic leak, it's about between 5%. All these complications rate is the minimal the type 2 diabetic patients. The 8th procedure in a patient with type 2 diabetes, and this is the risk. The other about the other procedures, coronary artery bypass in type 2 diabetes, risk 46% in the coronary artery surgery. Now thank you for your attention, my presentation.